The CDC is reporting currently that in states that are reporting COVID-19 data, although Black people are 13% of the population, we are representing 27% of the COVID-19 related deaths.
Starters, the CDC guidelines for going out in public are social distancing. And that's basically maintaining a distance of 6 feet between yourself and anyone that maybe does not live in your household. It's also recommended that everyone 2 years of age and older wear a cloth face mask, where social distancing measures would be difficult to maintain. So that's for starters. And a very big thing in disease prevention is hand hygiene, something we practice in the hospital on a regular basis. Washing your hands for at least 20 seconds with soap underwater. And then also if you're going to wear gloves, remove the gloves in a sanitary, safe manner, but then also try to wash or sanitize your hands as soon as possible. Well, seeing as though the order was just recently lifted, it may be too soon to say, but the concern is that, as we attempt to continue to flatten this curve, if there is a increase in cases and those cases that require hospitalization, there's concern that the hospital system would be overwhelmed. My takeaway message would be to stay safe. The businesses that have been opened, they are important for those people who need to make a living, but they are not essential to keeping us alive. Right. So stay safe, distance socially, wash your hands, and if you are sick, please stay home.
Being up in Michigan.
Yes. Yeah. So we serve primarily low-income immigrants, refugees, and other communities of color in Detroit. And for better or worse, really for worse, the upper Midwest has made news recently regarding the coronavirus. Yeah. You may have heard about the in-person election in Wisconsin, or maybe the armed white supremacists defying Michigan's stay home, stay safe order. I think there hasn't been enough coverage of the devastating effects of the coronavirus in Detroit. We have death rates that are comparable to New York City, but Detroit is not receiving near the attention that New York does. Statewide in Michigan, the coronavirus infection and death rates are disproportionately high for Black people, who make up less than 14% of the state's residents and more than 40% of the state's fatalities. And we're also seeing really high rates of infections among other people of color and immigrants. So my organization in particular is funded, one of our largest sources of funding is faith communities, because the government will not fund our work to serve immigrants. And so faith communities can really step in and support their neighbors, especially their immigrant neighbors who are left out by government services. So I'm impressed by the local faith communities sort of seeking us out, looking for gaps, and trying to support those gaps. I think the other way that we've seen faith communities do amazing work is they can provide funding to individuals very quickly without a lot of red tape. And that can make all of the difference for survivors or immigrants or people of color, other people excluded from government resources. And to do that, they need to be very explicit about, or where we've seen them be most successful is the communities that are very explicit about being open and welcoming and intending to really bless and serve their neighbors. And when they have done that, the impact on the community has been really remarkable.
The response has been positively overwhelming in a good way. People have appreciated the fact that we stepped up to the plate to speak to the people that we serve. particularly those in our congregations and people who are at Concerned Black Clergy. We wanted our people to know that just because we have permission to go out and do certain things, it doesn't mean that we have to. So we admonish them to just stay home and just kind of ride it out, because we don't want to create and cause this thing to blow up again and have a second round, if you will, a second bout with this, and it'll be even worse than the first. So we got it out there, and we're glad about that. Our young people, we zeroed in on because it appeared that they were not taking it as seriously as some of us older adults. We saw them different places and just really happy that the governor made his decision to open up certain things, but there were no guidelines that they wanted to follow. He gave some guidelines, but it's not that they wanted to follow those. So we were really zeroing in on them as well. You know what, at our church, I'm a member of Hunter Hill First Missionary Baptist Church, and we have a vast youth and young adult department, if you will. And out of this, from our churches with them, they have been able to establish and develop more ways to connect. We've had more young people to even come in and be a part of it. So we've been able to reach more people. So something good has really come out of this for our churches and for our young people particularly. So they've been able to see what other young people are doing in ministry. They've been able to use their own vernacular when they say things like, how shall I say? They say things like, God is dope. You know, I couldn't get with that. I just didn't understand what that meant. But out of this situation, a ministry like that has come out where they can be themselves and reach more people. So it's been good. It's been good.